People look at people with mental disease and think they're crazy.
They say you're mad.
Mental illness is definitely misunderstood.
Crazy.
Mental illness is biological.
Stigmatized.
You looked at differently because of what you've been through.
I spoke to somebody the other day who said, people with mental illness shouldn't be allowed to have children.
You're compartmentalized by society.
I had terrible depression, and the sad part is that I didn't know that it was depression.
I couldn't stop my thoughts. I was moving from one thought to the next.
You feel down. You feel bad.
I was in a hopeless, bottomless pit, even in a crowd. I felt so alone.
The biggest thing of being alone was that nobody really explained to me what bipolar was.
The person should understand what they're dealing with.
It was extremely difficult for me trying to deal with it and understanding what is going on.
When you've got a wound, everybody can see and sympathize. With mental illness, people see nothing. So that's why they don't sympathize or care.
I didn't want anybody to help me, and I didn't want to do anything. I just lay in bed feeling sorry for myself, hoping it would swallow me up.
Having a condition doesn't say anything about who you are. It just says something about what you experience at a certain moment in time.
The first step is acknowledgement. Knowing, okay, something is not right, I haven't been feeling well.
I started, inquiring about certain emotions that I was feeling, making research, and I realized that, okay, fine, maybe let me just go see a doctor.
When I first went into a clinic and we started changing my medication a little bit, but then also the coping skills, speaking to a psychiatrist and a psychologist, which made a lot of difference.
I've been taking antidepressants for more than 10 years because I suffer from a bit of depression as well. And I don't see that to be defective or negative or make me less of a person.
In choosing medication, you need to be very aware of all the patient's variables so that you've taken everything into account and the patient's compliance with treatment will be enhanced.
First and foremost, realize that you're not alone.
If you form a support group, you can know that you are not alone. Because the feeling of thinking you're going through this journey alone, that is so terrible.
We as people living with these conditions have to make sure that we manage it.
Mental illness and many other illnesses are not just about focusing on the one problem, it's about addressing your holistic look at life.
Bio-psychosocial approach. And as much as we're treating biologically, we always have to be very cognizant of the psychological and the social aspects that inform mental health.
We're medical doctors with a good understanding of brain diseases, and we have effective treatments for a lot of the conditions nowadays, so people don't need to suffer.
Mental illness is not a death sentence. People with mental illness can have productive, successful, well lives, provided that they get the care that they deserve and that they are able to recognize what it is that they need.
If you go to the more urban areas, there's built-up facilities, there's more resources, there's an abundance of psychiatrists, there's access to proper medication. But the minute you step out into the rural areas, there's nothing.
The focus is on TB, HIV, infant mortality, maternal health and violence. Psychiatry touches every single one of those foci that is being postulated by national government.
Psychiatry and mental health are so stigmatized, and there's so much ignorance about it that insufficient priority is given to it by decision makers, by policy makers, by funders.
We get so little of the health budgets in the private sector. Often the plans are not sufficient to cover mental health. So I'd like to see equity as far as mental health conditions are concerned.
If there could be more of a platform for public awareness, and with the public awareness I think will come increased understanding and tolerance.
I think more can be done from the private sector and also from government to improve the level of services that are made available in our country.
My vision and my hope for South Africa is that we become a society that are tolerant of difference, not only on a political level but also on a medical level.
is an illness. It's nothing to be ashamed of.
Don't be afraid to express yourself.
There's nothing wrong with having mental issues. You are fine, you are whole.
The role models need to come up and publicly say, I suffer from it and this is how I deal with it.
I readjusted my life around healthy eating, healthy thinking, and then I also started writing out my thoughts.
Once you accept yourself, then that is the most important thing.
My message to anybody who would be suffering from anxiety or depression is just don't be afraid to talk about it.
It's about having open hearts and tolerance and respect.
I am going to be one of those people who are going to speak up about depression. I'm going to take my power back. It's not going to control me. I'm actually going to share my experience so that somebody doesn't find themselves in a situation where I was.
There is always an alternate solution.
Help is available. It's often merely a phone call away.
I do feel I am stronger having gone through what I have gone through.
It's no shame to call out for help.
There is light at the end of the tunnel. Life is worth living.
There is hope, there is treatment, and there is support. You don't have to suffer in silence.
Let's talk. That's what it's all about.